hit the recording. And I guess for those that are not live, good morning again, good afternoon, good evening. And I wanted to say a few words about our expert on this webinar. So welcome, Miss Jerry Brewster. She is so honored, and I know this because we've spent so much time together over the last few years, as Jerry has been able to get to know a little bit more about chromosome 8p, particularly with my daughter. And I've been waiting to introduce her to the 8p community to kind of discuss with us how to just improve our overall health and well-being. And so while the topic today is a little specific towards constipation, I assure you that it will be beneficial to not only our amazing 8p heroes, but also to each of us, myself as a caregiver, all the caregivers, extended family members. It's not easy. And so I really do encourage you guys to take notes if you can, and also ask questions towards the end of the call. So Jerry, welcome.
Hi, everyone. Thank you. Thanks, Bina, so much for asking me to speak and be a part of this community. And I have, full disclosure too, as Bina and I have discussed, and I recently met a couple of the other parents through a Zoom forum with children with chromosome 8p. I'm here for you guys as a resource. I started my clinical career 38 years ago in the area of developmental disabilities. And while Karina is the first child, now it's been a few years, with 8p that I have been working with, I tend to be very outcome oriented, and I like to bring all my experience in the field of developmental disabilities and nutrition, nutritional sciences, nutritional biochemistry to all of you now, so that we can really optimize just health and wellness and development to the best means possible. So we're starting with constipation because it also kind of overlaps with tone issues as well. But what I probably should have included in this slide deck, which is really just going to serve as an outline for us. And then I do, as I said, want to be here for you guys. So if you, whatever questions you want to submit, and at any time that Bina feels it's appropriate, we can interject in here to just embellish on any particular area. So, I don't want to just be kind of talking at all of you. But we figured that, constipation is such a significant issue, and what I should have put in here from other lectures that I've done is a kind of a cartoon slide that I have of just a woman, cartoon caricature just sitting there saying, nothing feels as good as having a good poop, and I think that our lives can be surrounded, or our bowel function really is what dictates so much of our day, and then our overall ability to function. And so for our children, yeah, I'll stay on point.
Okay.
So certainly for the sake of your children and all of us, really, to understand and appreciate just how the core of the gut and functional motility and evacuation is so essential to all the rest of the body. So here's our disclaimer. Certainly this is a compilation of information that I want to share with you. You can take it into consideration and most certainly discuss any change in treatment plan or any of these recommendations with your child's primary care provider to see what would be appropriate. So, and as Bina mentioned, this is being recorded. So in terms of any information that you're going to mention pertaining to your child specifically, to just be aware of that from an anonymous standpoint. So I figured I'll start with fiber, right? Because I'm sure this is the plan that most parents are told, right? It kind of comes down to fiber and fluid. So I wanted to just sort of do a little bit of a constipation 101 here, where you can understand that, you know, like everything related to food, the plot thickens. So we could say fiber. And you could maybe use various fiber supplements too, as well as the food. We want to start with the food, but sometimes we need a little extra fiber boost. But it's important to appreciate that there really are two types of fibers, and they have different functions. So the soluble fiber, right, like the oatmeal, apples, you know, some of the other foods that are noted there. Soluble fiber, it forms more like a gel, kind of like more of a gelatinous. It gets kind of partially processed or digested in the gut, and it actually adds bulk to the stool, but bulk in a more in a thickener type of way, which is why soluble fiber can be recommended even for when you have diarrhea, because it adds a little bit more substance to the stool. So things like, you know, when you think about the acronym, and this may not be universal worldwide, but in the United States, the acronym is the BRAT diet, B-R-A-T, but it stands for bananas, rice, apples or applesauce, tea, and toast. So it's kind of like the bananas, the rice, and the apples are all rich in soluble fiber. So they tend to kind of give more substance and solidness to the stool to decrease diarrhea. And then, of course, also the starchiness of breads, and the tea aspect more for electrolyte repletion. This is if a child's having like diarrhea or loose stools from a you know, a bug, a virus, a GI virus or something. So those are soluble fibers, those apples, bananas, and rice, and oatmeal, and nuts, and beans, and lentils. So they can make the stool a little pastier. So sometimes if constipation's a big issue, you don't necessarily want more soluble fiber, especially when constipation is really coming as a result of low tone. So there's that muscle flaccidness or just, you know, weakness. So everything just sort of gets more packed in there, versus say insoluble fiber, which doesn't dissolve in water. And so it's more like an irritant, so to speak. It's all those insoluble fibers, the real hulls and husks, the tough stuff. So the brown rice, the vegetables, certainly wheat bran. Now, a lot of kids may be on wheat-free diets, and I can certainly appreciate that, because wheat is a fermentable compound, so it can create more gas and bloat. But these are the differences in the fibers. It's pretty much anything other than those bananas, rice, apples, oatmeal, some of the different beans and legumes. And also some foods are mixed. Beans and legumes also have a certain amount of insoluble fiber. That's also where, like, there's a popular product in the United States, and I think it's pretty worldwide, which is Metamucil, which is basically psyllium husks. And psyllium is a mix of soluble and insoluble. So pretty much the rest of all your vegetables and your fruits are going to be, outside of the apples and bananas, are going to be insoluble sources. So anyway, we can move to next. And insoluble, like I said, it pushes things through. It's more like it doesn't dissolve. It really kind of irritates, for lack of a better word, to stimulate that peristalsis and get everything moving and out of the GI tract.
Jerry, I just have a quick question before I move to the slide. The link at the bottom, I noticed you have links for everyone. What are those? Are those something that they should just click on? And
it was just also, I grabbed this one, I think, out of, was this the Harvard one? I can't see the
yes.
slide. Yeah. So yeah, so definitely there's information on those, at those sites for, to expand on all of this.
Okay, great.
And then if anybody does have specific questions, to the best of my ability, if we don't cover something here, I think my email is at the end also, so, or they can go through you. All right, so I already mentioned about the fermentation aspect. So, and that's why I thought it was worth adding this additional information on here too, some of which I already mentioned. But it works in 3 different ways. So it's adding the bulk, and then because I don't want to just read my slides, you guys can read them as well as I can, but it works on providing the bulk, and it works on providing sort of that irritation, so to speak, that movement or stimulating peristalsis. And then it really works to provide a food for the bacteria in throughout our digestive tract, small intestine and large intestine. But when we're talking about bowel evacuation or bowel movements, we're pretty much focused on the good flora that should be in the large intestine. So you do need a mix of both types of fibers. So that fermentation aspect is what does happen, because the foods that we eat, and especially the soluble fibers that get partially digested, they get consumed by this bacteria. That bacteria forms certain compounds that actually help maintain the health and well-being and integrity of a good functioning digestive tract, which has everything to do with digestion and assimilation. So this is why we always hear so much about the benefits of fiber and plant-based diets. You know, certainly a Mediterranean type of diet with small amounts of animal protein is perfectly fine and has great epidemiological studies behind it as a diet to really uphold the health and well-being of human species from dietary studies. But the foundation is plants, and that is in order to provide this good fiber base, as well as all the nutrients, other nutrients that come, and we will discuss that in further talks, because otherwise I will digress now into all the benefits of plants and vegetables and fruits. But that fermentation component, of course, we can get over fermentation, right? And everybody can get distension and bloat. So it is that delicate balance, but you can appreciate that it's the food from the plant-based component that is feeding the bacteria in the gut, which is really setting up gut optimization and function. Okay, thank you guys. All right, so this is just basics in terms of what a child needs. This information came from Cleveland Clinic. And I'd have to say, if you I always think it's a good idea to even keep a log of your child's intake, maybe from 1 to 3 days. And then whether you kind of want to calculate just the fiber component, or you want to throw it into, into something like an app, like, again, like the MyFitnessPal app, which is very common here in the States, and you can get a breakdown of total calories and the macronutrients, the proteins, fats, and carbohydrates in the course of a day, which actually, I'm reminding myself to just explain that for a moment to you guys. When you look at a food label, it will say the total amount of carbohydrates in a food. And then from there, it breaks it down a little further. It will tell you how much of those grams of carbohydrate are actually fiber in that food. Some of those labels will break it down further into soluble and insoluble fiber. And then it will tell you how much of those carbohydrates are sugars. So basically, because all of us are coming to this gathering now with different sort of food and nutrition IQs, as I call it, we sometimes none of us have had to think about it. And now suddenly you're having to get a whole, you know, introduction and immersion into nutrition. So let me back it up right now and apologize if I'm not giving enough detail. So basically fibers would fall under carbohydrates. So our macronutrients, the ones that our bodies use as their primary source of energy and growth, are proteins, fats, and carbohydrates. And the fibers fall under the carbohydrate component. And that's compared to the micronutrients, which are really the minerals and the vitamins and a lot of other trace nutrients and phytocompounds or plant compounds like antioxidants, various polyphenols that have been demonstrated to reduce disease, reduce inflammation, keep the body more alkaline. And we will talk about all of that at some other point, because antioxidants are so important for any amount of inflammation in the body. And kids with chromosome 8p are dealing with more stress in their bodies because it requires so much more energy for every physical command. And in that physiological stress, there are more oxidants produced. So therefore we want more antioxidants coming into the diet. And again, we'll talk further about that, I think, probably the next time we all get together. But we've got these fibers coming in that carbohydrate section. So it's often broken out as well in these apps. But you can kind of calculate just to get a baseline, because sometimes I'm like, you know what, these might be the ideal recommendations. But if you're, you know, if you have a 4-year-old and you did a rough calculation and you see that they're only getting maybe 5 grams of fiber a day, then you don't have to jump right up to 25. You'll see just by adding a little bit more. We want optimization. So we're going to start with wherever your child is, and we're going to go from there to optimize their bowel function. So the next slide tells us a little bit more about just general fiber information in terms of how much you can calculate roughly, right? And again, all this information, you can get so much more information on in terms of fiber counters, and everything is online now. Excuse me, I'm just gonna have a bit of water.
Jerry, I had a question as you take that break. For the prior slide, we have children's ages, and I just noticed that what would be the targets for young adults and even just, you know, adults in general?
You're usually aiming for around 40 grams of fiber a day, ideally. And even that is a reach for a lot of adults. So again, you kind of start with where you are, because then there are plenty of adults that are really already enhancing that by adding different, even supplemental sources of fiber, whether they're adding something like a benefiber or a metafiber or a metamucil, or so, but you want to at least start there. But this is just a rough estimation of, you know, a half a cup of beans or legumes is 6 grams of fiber, and again, a bit of a mixed fiber, soluble and insoluble. And then a half a cup of cooked vegetables is going to give you 3 or 4, and fruit. So the idea is, when you think about how, from a vegetable and fruit standpoint, kids should be getting, you know, really like 5 to 7 servings a day, and a serving's generally considered a half a cup cooked or 1 cup raw, or saying, you know, medium-sized piece of fruit, or a half a cup, say, of melon. But 5 to 7 servings a day, then you can easily see, based on the of vegetables and fruits, you can easily see based on the how much fiber shows up in those servings, that you can get your fiber allotment in a day. Adults should be having 9 to 12 servings of vegetables and fruits a day. But the problem is that we fall short because we will slide into things that are easier, and things that are easier tend to be things that may be a little more processed. And you know, like that's been the whole issue, even from a public health message around the world, of all sort of just the white foods, right? Like the pasta, the breads, you know, the white rice, that it really doesn't have so much fiber, and it's just, but it's fast and convenient and it fills us up. So then when you're filling up on that kind of stuff, or just even like snacky things, you know, even a lot of the puffed snacks and all, there's not much fiber present there, but yet it's filling you up. And then you get through every day, you're in a fiber deficit, and then there's that cumulative effect. So this is just about even taking stock in terms of where's my fiber intake, where's my child's fiber intake, and then how can we maybe embellish their diet to encourage more. Now, this is also vitally important, because fiber is only going to work as well as how much fluid is going into the body as well, because the fluid is what either moves the fiber through, like that insoluble fiber that doesn't really dissolve, but just like I said, kind of works more to kind of irritate, so to speak, and move everything out, stimulate that peristaltic movement out of the body. And the soluble fiber does mix with water to create that bulk. So you have this ideal to get, you know, a large formed stool and evacuate all that waste out of the body. So these are fluid requirements, and this is also something to make a note of and assess from a daily intake standpoint how much your child is getting. And this is kind of something to do for the whole family. I mean, this is just good foundational nutrition. So it's a good exercise to do not only for a special needs child, but also for everyone in a family, to just see where they are. So it gives the requirements on this slide, the calculations, and then I just put in here, just sort of transferring from kilograms and milliliters over to pounds and ounces. And I made that other additional note in terms of the, you know, that wet foods. So soups can be included. If it's like, say, a very soupy type of, say, pear sauce or something, because I realize certainly for 8P kids, many of them may have an aspect of dysphagia or difficulty swallowing, and fluids need to be thickened. So you're really going to be counting just the actual water or fluid part. So you might have 4 ounces of fluid, but then you have to add enough of a thickening agent. And that's actually something else I want to come back to too. But you have to add enough of a thickening agent that's going to increase the volume of that fluid, right? So if, say, you have just some water, but you're going to thicken it maybe with like some pear sauce or applesauce, and blend it so it has more like a honey consistency that has a little thicker viscosity, to allow the time for that coordination for the epiglottis to close over the trach and protect the airway, to allow the fluid to go down the esophagus, because fluids travel very fast. And if that muscle coordination isn't there, some of that fluid could slip in, and we want to certainly prevent any type of aspiration pneumonia. So, so fluids would need to be thickened. But say that whole mix is going to be now 6 ounces, but technically you only have 4 ounces of fluid in there. The rest is a solid. So you can't say that that's 6 ounces of fluid. You know what I'm saying? So in a soup, even if it's an 8-ounce bowl of soup, can you go back to that for a second? I just want to, so anyway, I won't belabor it. I think you get the idea, but I just wanted to say to this, again, for parents that are taking their own assessment, fluid requirements are based on your body weight. So if you are 150 pounds, it's half your body weight in ounces. So you need 75 ounces of fluid a day, and the majority of which should be water, or a decaffeinated tea would count as a water as well. So let's say 64 ounces of water and decaf tea, or even including carbonated, like just seltzer, like just bubbly water, as opposed to, you know, nothing with a sweetener. I'm talking just pure water source, maybe 64 ounces there. And then the remainder to the 75 ounces could be, you know, coffee, or, you know, a caffeinated beverage like an iced tea, or a cocktail, glass of wine from a fluid standpoint, but that would be the minimal amount in terms of calculating your own fluid requirements. Okay, thank you, Bina. All right, so what I was gonna mention before when I was talking about thickening agents and fluids, some of those thickening agents are actually soluble fiber. So if you feel that maybe, now that I've talked about the fact that it's those soluble fibers are a little bit more of a bulking or stool thickening, also stool thickening agent, and your child is suffering with constipation, you know, you may want to consider adding insoluble fiber sources or other stool softeners, natural stool softeners, and I'll get into that over here on this next slide, or maybe looking to change the thickening agent or changing it up a little bit. You know, maybe for just say water, you want to add a thickening agent that might be a soluble fiber because it blends easily. But if your child does do a little bit of a juice or a milk or a formula or a milk substitute, a milk alternative, you know, maybe you want to blend some fruit in there, or even some mild pureed vegetables, like more like a smoothie where you can incorporate more insoluble fibers into their beverage and not just be relying on a commercial thickening agent that may in fact be all soluble fiber, and perhaps adding a little too much bulk but not enough stimulation to move that, to stimulate moving the bowels. So all right, so then we've got here the various natural stool softeners and the peristaltic agents. And prunes, most certainly, they have certain types of carbohydrates, components in them that develop as a process of drying out those plums. That serves two ways. It both softens the stool and it stimulates bowel evacuation. So prunes can be great. The thing is if it's been many days that you're, you know, say prunes are always part of your child's routine. And my personal recommendations generally when I'm working with a family to develop a nutritional care plan, I do think there should always be a set of foundational good foods and maybe even nutrients, like the magnesium is a good nutrient. Our muscles need magnesium. So if you're using magnesium as a nutrient, if it's in the oxide or citrate form, it also serves as a stool softener. So maybe something like prunes and magnesium are always going to be in their foundation on a daily basis. The thing is that if your child's getting very backed up for any reason, despite their foundational plan, sometimes dumping in more prunes or prune juice. And by the way, prune juices, I'm sure many of you know, can be a little on the bitter side, whereas the prunes or pureed prunes are a little sweeter and a little more appealing for a child. But sometimes you can take some of the pureed prunes and just add it to prune juice as well, even like from a thickening prune juice standpoint. But if you are just going to wind up trying to dump more prune juice in for the sake of an evacuation, it can sometimes just create more bloat and distension. So again, talk to your primary care provider about building a more personalized constipation management protocol for your child, because sometimes it does get to the point where there is so much of an impaction down in the lower colon and rectal area that it's just, the longer it sits there, the more water is drawn out of it. So the drier it gets. And sometimes it does require either suppository or enema, as I'm sure all of you are familiar with. So you may have to have that as part of your protocol that you discuss with your provider, because just continuing to dump more in from the top down can become very uncomfortable. And sometimes you get to where it's been a couple of days and you need to just work from the bottom out. But generally, aloe vera works also as a stool softener, and also can increase some peristalsis too, because it has some compounds in it, almost like natural bitters, that will help stimulate peristalsis. MCT oil, or medium chain triglyceride oil, is extracted from coconut oil. It is not, it's good for energy supply as well. So probably many of you might have noticed it even in infant formulas. It will include MCT oil because it's readily taken up by the body and the cell as an energy source. But there's a component of it that actually just kind of works as a bowel lubricant, and it can help to really soften or just help the stool to slide out, so to speak. Things like ginger and artichoke leaf and senna tea or senna leaf, they can all, because all of those last three, they're also all available as teas, besides available in a supplemental form, or senna or Senna-Cot is a constipation medicine, and maybe some of that can come in liquid or tablet form. So senna, I would say, is probably the strongest, most effective out of those three. The ginger and artichoke leaf will add a little bit more of that support gastric emptying, and a little bit more of that gastric motility in some of the studies that have been done, which is why they've been shown to work more in sync with even some reflux component as well. And that's maybe another issue to discuss also, because when there is low tone, that ability for that lower esophageal sphincter, the muscle at the base of the esophagus, isn't going to be as tight or as strong as it needs to be. It's going to be a little hypo also, and loose and floppy. So there's going to be an inclination more toward reflux and things coming up. Now, just from sort of the laws of physics in terms of equal and opposite pressures, if your child is very constipated and backed up, any amount of even straining can encourage more reflux activity. And then at the end of it, their whole tummy from top to bottom doesn't feel good, and that may discourage interest in eating. And because communication is very challenging, it's really hard for you as a parent to really be able to assess exactly what is going on. So even if you feel that your child's normal is to have a bowel movement, say every 4 days, maybe it would be better to work on a bowel protocol to encourage an evacuation every 2 days, because then you may ultimately get a little bit more interest in intake, which will ultimately provide more nutrients to serve their cells, which helps with the tone optimization, and of course then cognitive optimization and function. So everything goes hand in hand around this whole gut issue. Okay. Oh, yes. So this is something also that I always want to, and I'm glad the slide is there because I might have forgotten about mentioning all these ever important sort of rules around potty, because I think when constipation is an issue, you're just happy to take a bowel movement whenever it happens, and you kind of wait for it to happen, you know, despite everything that's being kind of poured in to encourage it. You kind of just wait for it to happen when your child has that urge to have that bowel movement and to make it happen. But sometimes that urge isn't really going to happen naturally because if everything's getting packed into that colon, you know, we get a little bit of this megacolon. It just sort of stretches out, everything gets impacted in there. And then even the nerve endings in the muscle, they're all kind of separating. So they just sort of get a little dulled out. And they're a little dulled out anyway, just by virtue of the hypotonia. So they're not going to respond necessarily to that, to coming out. So sometimes whether you expect a result or not, however your child moves their bowels, if they have a potty that they sit on, or there's a particular, if they're having a bowel movement in a diaper or a pull-up, but there's a particular place in either their room or even the bathroom or a corner of a family room that they like to go for their private time when they feel like it's going to happen, then encourage them to move to that spot daily as part of just a regular part of the day, so that it may happen, it may not happen, but it's just going to be part of a daily routine. So if it's after a meal or after dinner, or maybe even after bath time when they're nice and relaxed, if they've had a warm bath and they're a little more comfortable, that they can then focus, because sometimes depending on all of the therapies in the course of a day, it's kind of now like, oh, now you want me to focus on pooping, you know, it's so maybe just sort of, I know you want them just sort of then all ready for bed and tucked in, but maybe that's the time of the day to have them, if they do sit on a potty or to kind of read a story, to just be able to, I see some comments popping up, but we'll get to everything. To maybe encourage a potty time, a daily routine potty time at a specific time of day, just to help stay in sync with their body rhythms. And I certainly already mentioned the tone, because of course you're talking about engaging muscles, which is such a challenge for 8P kids. To be able to command, to do for evacuation. So that's where certainly movement, and as I put, even like passive movement. So just even if your child is lying on their back, just, you know, moving their legs, knees to chest. If you're working with different physiotherapists who can help you with some of those exercises, and just belly massage, just clockwise, circular, maybe with a little bit of a nice massage oil, to just help engage their gut. And then certainly positioning, if they are on a potty, it really should be, so even if they're on an adult potty with maybe a seat to accommodate their size, make sure there's a stool under their feet. They need to have that leverage. They can't be dangling there. So next slide. Okay, so in terms of laxatives, and the thing is, I know that I've had parents with children with various developmental conditions that are concerned about reliance on anything, be it natural or a laxative, because they feel like, well, it'll create dependence. But when we have an underlying physiological medical condition, such as the hypotonia that comes with 8P, there's going to be constipation, and we have to have bowel evacuation. So we are going to work first on building the food and the fiber, then maybe some of the natural foods and assists and compounds, like I mentioned in the other slide, before the potty time, whether it's the prunes or the magnesium or a little senna tea. Then you may in fact still need to move toward a more pharmaceutical type of laxative. Now, one thing that's used often is mineral oil, and that, from a nutritional perspective, is not anything that should be used with any amount of regularity, because unlike the medium chain triglyceride or the MCT oil, mineral oil will actually capture or sequester fat soluble vitamins and fatty nutrients and eliminate them with the stool. So you're further depleting where there might already be a problem with assimilation and nutrient absorption. So we never want to rely on mineral oil. Miralax is something that is frequently recommended. And again, I think many parents that I've worked with across the years and would like to reduce reliance on it, or minimize the amount of it, or maybe only use it on an as needed basis. So here's where, again, building up something like MCT oil, which can provide good cellular energy, as well as help lubricate the bowels. The magnesium, again, for good mitochondrial function, as well as soften the stools. Prune juice, which will provide some of those really beneficial fibers and compounds to allow for that healthy integrity, those short chain fatty acids in the colon that were mentioned on that other slide. So we want the good foundational bowel support there, because it not only helps support the bowels, but it's helping to support the rest of the body. Then if from there on occasion you need to put in a little Miralax for that ultimate elimination, that can be a very nice way to bring it all together in terms of a constipation management plan. But again, you can talk to your must talk to your providers about that. And the same for lactulose, is a different type of carbohydrate. So Miralax is this polyethylene glycol compound, synthetic compound. Lactulose is a compound that's basically, it's just a molecularly altered form of a sugar or carbohydrate that will pull a lot of fluid into the colon in an attempt for the body to dilute it, but in bringing that rush of fluid to the colon, it will help push it out. It's kind of like it's like kind of the same way like an enema goes in and all that water then helps to release but the lactulose goes in the other from the mouth down and through. The issue with lactulose is it can be very gassy. So again, if there's then gas and distension and bloat and maybe reflux exacerbation. So if your child's using lactulose, or there are other varieties of that, again, maybe building this foundation from the foods, you can reduce reliance and make, things more comfortable. Because this is the sad part, is that this bowel movement is like going through like labor and delivery. It's a big mass to move out, and it can take days and hours, and be so uncomfortable for them. So then even if they do have the urge, sometimes they don't want to feel the sensation because it's not associated with anything good. So the longer that everything gets packed up in there, sort of the worse that event becomes. So that's why if we can work toward, more daily or every other day with enhancing their diet, that's the best. The Senecot I already mentioned when I talked about the Senna tea, and I think we're going to be rolling into our Q&A now. So thank you. Should I take I can't look at the chat. Or can I look at the chat?
You should be able to. Thank you so much, Jerry. Yeah, you guys feel free to unmute yourselves.
Yes, pooping in the tub. Oh, I know. Okay. Well, at least you're prepared for that. And so, that resonated when I said a bath could be very relaxing and then it can just move out. So, have you ever seen small fevers? Yes, absolutely. Well, what's causing it is really, there are inflammatory compounds that can get reabsorbed into the bloodstream from the stool. And most certainly you'd always want to be discussing that with your doctors, just to make sure that there isn't any way that there's even any fecal matter, you know, entering. I don't think it would be, I think you'd know certainly by now, God forbid, if there was really any transference with regard to the feces itself. If you get the low grade fever and then it's eliminated right after the bowels are eliminated, I would say that it's probably more related to the stress and the absorption of some of the organic acids that are being produced from the bacteria in that stool. So again, I would think that the more frequent and regular the bowel movements could be, the less likely that's going to happen, because then of course a low grade fever is going to dehydrate your child a little more. That dehydration is going to make that stool even harder to pass. How many MCT oil can we add in each diet or meal? Is empty? No, actually, so the MCT oil is extrapolated from the coconut oil. I mean, I don't know, again, I can give you some generalities, but I don't know the size of your child or all of the particulars, but I would probably start in a young child with just a teaspoon of MCT oil mixed into anything like a soft cereal or a smoothie. Again, it's an oil. So if your child's at risk of aspiration, you have to be very careful, because you never want an oil aspiration. So you have to make sure with any kind of fat compound like that, that it's well mixed and blended. But I go 1 teaspoon, 2 teaspoons to a tablespoon, depending on the size of the child and the tolerance and how well it works, maybe 1 tablespoon twice a day. My drinks only water, apple. Yes, those 3 do count as fluids. The other thing about, though, even milk and dairy products can be binding. I know we tend to think of the lactose in them making us a little gassier and maybe having looser stools, but sometimes the proteins in cow's milk can be a little binding for some people. So it might be worth trying changing up the milk source, either a goat milk or possibly even the A2 milk, which comes from the smaller herd cows, or a milk alternative for a little while, just to see if that makes any difference. Oh, Bina, that's your. Okay, from an AP. What foods make you sleep poorly? What type of food? Okay, I guess everybody can see the chat, or should I be reading that? Everyone, it says to everyone, right? Is everybody on their chat mode?
Yeah, I think everyone should see it.
All right, so what foods make you sleep poorly? Well, I suppose any food might make you sleep poorly, but I would tend to go with more of the protein denser foods, because they empty from the stomach more slowly. So you're going to have more of that full feeling, which might be hard to fall asleep with. And if there's any kind of either reflux activity or sleep apnea, you don't want that stomach so full, pushing on the diaphragm. And so meats and protein foods tend to move the slowest through the digestive tract. And that's, so maybe from a carbohydrate standpoint, they empty faster. So, like a bowl of cereal or something like that is going to empty faster, certainly than having a hamburger at bedtime or close to bedtime. What type of food would be better so that they are not so constipated? All right, well, that kind of goes back to the earlier slides and just assessing what your child is eating over the course of the day and looking at maybe the sources of soluble fiber versus insoluble fiber, and see where maybe you can enhance more of the insoluble fibers, and maybe just upping more plant foods in general and bringing down some of the meats. You know, maybe your child's a meat eater and they need to eat meat. Maybe they're iron deficient, and so you're always working on, like, you know, burgers and meats, but that can kind of slow down transit time a bit. So, and for that reason, sometimes it even helps, like the concept of food combining, like putting meats with vegetables, so that the vegetables, the insoluble fiber from the vegetable, help at least move the meat through. And then if you're going to do something starchier, like that's higher in soluble fibers too, like a rice or oats, to maybe also mix that with some vegetables, so that can really help move things through, as opposed to taking, say, that starchy rice and putting it together with that meat. Both of those are gonna really slow down transit, plus be that soluble fiber that's gonna cause more of that mass. So that it can be considered as well too. So you can not only look at what your child's eating, but what the combinations are looking like, and what we can do to maybe facilitate gastric emptying a little bit. Although I think that many times they retain it. Yes, I agree. They retain it because they don't want to expel it, because it's not a pleasant experience. So that's why I think that you have to work on almost like that daily kind of poop regimen, even if a poop doesn't happen, just to kind of get them prepared mentally and desensitize a little bit to the process. So the daily kind of cross crawls, even if it has to be done passively, like I said, if they're on their back and you're just kind of moving their legs back and forth and massaging their belly, and kind of just prepping them between the diet and that exercise time, and then the warm bath time, and then maybe sitting on the potty or moving to that place in the house, that should all happen every day, even if it doesn't result in a result every day. But certainly by the time you get to day 2, you should have your backup plan to really facilitate getting it out, whether it's then adding that laxative component or going to something gentle like a glycerin suppository, because then by day 3, if none of that has worked, you probably need to move toward an enema in order to just move everything out, because after 3 days, that's an awful lot of backup. And again, I just threw that out there as a protocol, but you have to discuss that with your healthcare provider. When using magnesium to aid in constipation, is there a downside to this apart from loose stools? Well, the other thing is you have to also monitor the amount of magnesium, and that's why even maybe before embarking on it, you can maybe just even get a baseline magnesium level in the blood. Magnesium we usually get from our deep green leafy vegetables. So if your child's not even eating a lot of those, they may not be getting so much dietary magnesium anyway. Also, some nuts and seeds are sources of it also. So if you're not getting a lot dietarily, you could probably benefit from some supplementally. But I've seen where parents have come to me with protocols, and they're really on, a very small child is on an awful lot of magnesium, and you'd want to maybe get it tested when they have maybe their iron levels tested. Your magnesium levels could be tested too, because you don't want to over magnesium anyone. It just it throws off everything. Muscle, your heart is a muscle, right? It needs magnesium, and all your muscles need magnesium, but too much of it, we don't want to slow down heart rate, etc. So you can't just keep pouring it in. So that would be the downside. Exercise help to tone the muscles that move. Yes, absolutely. So that's where, as I said, whether it's active or passive exercise, depending on your child's abilities, that definitely helps the bowels. And as I said, even just that massaging too from
sorry, I wanted to add to that too, to the community, that we'll be trying to put together some pre-recorded techniques, massages, movements, things you can do if they can walk, if they can't, just to be able to help stimulate and move those bowels and try to get them to kind of activate those muscles and build that, you know, cognitive connection to that, like, I really need to push and get that.
Absolutely. But even all that movement, even if it's being done passively, stimulates just the brain, you know. I mean, the low tone is coming certainly from the brain, but then creating that movement, you're also reactivating or stimulating what is possible to do that. And this is work that's been done certainly over the decades with children with cerebral palsy. It was like the environment was adapted to them if they couldn't move. But now we saw from, you know, years ago that despite the damage, the neurological damage, the more movement, because we've learned about brain plasticity, that our brains do have the capacity to change and improve when given the right input. So that's both from that sensory and actual input, from the movement, and then it's also from the nutrients. A couple of other questions here that I wanted to just touch on.
And then we'll wrap up because I know we're
short. Yeah, we started 2 minutes late, so we'll just.
Okay, great. Thanks, Jerry. Okay.
So I would say, Dominique, that while aiming for daily bowel movements might be great, I would still just say even every other day, you know, because just to make some improvement, because I could appreciate that you're happier now based on from when he was younger. But if it's possible by enhancing his diet or any of the things that I mentioned to maybe get twice a week, that would be awesome. I mean, I've had so many parents even report back to me sometimes, you know, when they're like, oh, we don't know what's happening. Their therapists are saying they're just not on their game anymore. So I'm like, well, when did they poop last? Oh, I think like last Sunday. And I'm like, well, let's see if we can get a poop out. And then maybe they will be back on the top of their game with some of their therapists, because it really does affect everything. My son doesn't eat any vegetables or fruits. How bad is that? Well, you know what? I can certainly address that and the whole picky eating in our next conversation. If you guys feel that this has been helpful and would want me back, it's an honor to be with you all. But I would say that I would talk about ways to I'm okay with hiding it, because if it's better for them, like you can mask it in different things. So if they really like meatballs, then those meatballs start to have a whole lot of pureed vegetables mixed in there too. Maybe some types of pureed soups and stews or smoothies, because it could be a temperature thing too. So whether it's cold or hot, or raw, or, you know, and then even just from a slow desensitization, sometimes it's the color of it all. Just visually is overwhelming from a sensory standpoint. So we can talk about that type of stuff next time. I'd like to dive in a little bit more on that, but the clock is ticking. Does using laxatives make children hungry sooner? Well, possibly if you're really getting rapid transit and peristalsis, things are going to empty and move out faster. So it is possible, but it's not usual, but it is possible. Okay, I think we're good. Did I miss anything? I'm kind of reading rapidly, and plus I have my progressive glasses on here so I could see all of you and also read.
Well, you have something from Asia that says it's 2 a.m. here, but we're staying up for.
Oh, thank you so much. Thank you. I appreciate that so much. And yes, more on picky eating. We will, that's a big deal, I know. And we'll get to that.
I wanted to say thank you so much. I know there is so many topics that we've, triggered on, and we will, you know, kind of round up from the AP, those that have been on the call and those that will watch the recorded session. Katie Syverson also was really so helpful and is on this call. And to the 8P caregivers and heroes, feel free to reach out to her because she's really trying to put together a robust program, which will include Jerry leading a bunch of discussions. So I know Jerry's very eager to cover and answer a lot of the questions here, but even more so, you know, we just talked about picky eating, relationship to sleep, and some sleep disorders that we know all of us have been struggling with here and there, you know, how to kind of stimulate growth. And there's so many other components, the microbiome and gut brain, you know, mental clarity, cognitive boosting, and things that we should all be doing. So I personally have learned so much from you, Jerry, and you've really gotten my help levels and an improvement, and constantly remind me every time we touch base that it's not only about, you know, my daughter, but it's really about the whole family and us all eating healthy together. So just keep that all in mind for all of you on the call, that again, like, you know, while we're so hyper-focused on our 8P loved ones, that we really need to think about ourselves, and that self-care is critical.
Yeah, absolutely. That's why I mentioned, I didn't think to mention it from a self-care standpoint, but just a basic nutrition assessment for everyone in the family, you know, to be examining, because it's important. You know? And everybody has to be there to be able to be that caregiver. You know, we'll talk about your own adrenals and mitochondrial function at some point as well, too. So, all right. Thank you.
Well, thank you so much. Happy quarantining, everybody.
Yes.
Be safe and be well. Okay, take care.
All
Bye-bye.
Be well and